All right. So yesterday, June 26th, is designated as International Day Against Drug Abuse. The menace of drug abuse is causing and wreaking a whole lot of havoc in our society. And that is why we cannot throw a blind eye to the issue. Little wonder we're bringing in someone who's an expert in this area to look at how best to stem the tide of drugs and substance abuse in Nigeria. And joining me in the studios this morning, Dr. Dokun Adedeji. He is the CEO of Compassionate Care Recovery Initiative, CCRI. Dr. Adedeji, it's nice to have you back in the studios. Good morning.
Morning, Victor. Thank you very much for inviting me.
All right. So I guess the most convenient point for us to really begin this conversation is to really establish the idea behind the International Day Against Drug Abuse. So why do you think a day like that was instituted?
I think this was done, I can't remember exactly, it was June sometime many years ago that it was decided that a day like this should be marked in order to raise awareness about the use of substances and drugs then, and then the illegal trafficking because of the danger they foresaw.
Right.
That's why it's been marked every year across every nation. I think it was 1989 or 86. I can't remember precisely now. Okay,
so they must have seen that as the years were progressing, perhaps they are noting that some things were going to come in that time, which will lead to lots and lots of these abuses. Maybe.
Oh yeah, they must have seen something then. I think it was the little proliferation they saw
at that time.
And then proceed that, look, if we don't deal with this in time and begin to look at it and the ways of curtailing it, it's going to be like an epidemic, a global epidemic. So with hindsight, which has now become.
Yes. So with hindsight now, it was a good decision, right?
It was, absolutely.
So from your observation, is drug abuse a real source of concern for us in Nigeria? Or let's say across the world?
Across the world it is, particularly also the trafficking and also the synthetic drugs, the prescription drugs and others. But in Nigeria, it's a huge problem that we should look at. In 2017, the UNODC carried out a global survey, and they found that the global prevalence rate of use of drugs was about 5.6. For Nigeria, they found it was 14.4, which was like triple the global average. And then when they began to break it down, they also found that out of every 4 users in Nigeria, 1 is a female.
Wow.
And that the Southwest was the highest use in Nigeria, 22.4. Whilst Lagos was the highest in the country, 33%.
Right.
And that was in 2017, 2018. So if you can imagine.
So if you fast forward to today.
Oh, I tell you, it will be much worse.
Wow.
It will be much worse because at the rate at these things are being used and the age that we are seeing using them.
I was just having a conversation with some young students in the building interns, and we're trying to just look at the reasons why we're having these high consumption rate or perhaps the usage of these drugs and substances. And of course, they've given us their own thinking, which we'll also touch base on. But when you say that in Nigeria, the figures are alarmingly high, I'm just curious, where are we getting these drugs from? Or perhaps what kind of drugs are we talking about? Let's start from there.
Okay. I mean, for simplicity's sake, we usually classify this into 4 groups of the technical ones. Is socially acceptable drugs that people don't consider alcohol and cigarette. They're drugs and they're socially acceptable. The next one then is illegal drugs, the one that we all talk about, cocaine, heroin, methylcrystal, and then the synthetic marijuana. And then we go to the prescription drugs, which like tramadol, like Refnol, like codeine-containing cough syrup. Those are prescription drugs. And then the final one that I usually say is the miscellaneous. You can't classify them as drugs. That's why we call them substances. Something like gum, something like a Vostik, something like rubber.
Are people consuming those ones as well?
Oh yes, you bet.
In what form?
I mean, petrol, for instance, in the form of fumes.
All right.
So
you inhale it?
Oh yeah, people inhale. Some people stand by the dispenser and inhale it, or if you watch those who ride Okada sometimes, you see them open their tank and bend over it. That's inhaling, and then they soak away.
What does it do to them?
It makes them high. And you know the funny thing that I always tell people is, truly there is a high perceptually that comes with these substances, but they're not real. They're not real.
Okay, I need you to speak to that microphone properly. So there's a high that comes with it?
Oh yes, there is. I mean, that's why people take it, because it makes them have a kind of sensation that's never had before. which is sometimes is pleasurable.
So it's something different, because if the same fuel that you're smelling is choking for me.
Oh,
so
yes.
Why would I want to inhale that?
It's choking for me. But somehow, for some people, it elicits a different reaction. That's why some people do drugs, some people don't do drugs. We may get, we may have, let's say, exposed to the same substance, but it doesn't do, like some people take marijuana, it doesn't affect them in the way that it dramatically affects some other people.
Right.
And so that one says to himself, hey, why take this when he does this to me?
Right.
Whereas somebody says, oh my God, it was pleasurable. And then they continue in it.
Yeah, so if all those ones can be tolerable or perhaps can be tolerated, as the case may be, Dr. Adedeji, what is it with going to the sockaway to inhale it? I mean, what is pleasant in inhaling something from a sockaway?
It's the fumes, the methane fumes that comes from it, and also the pit latrine. They go there early in the morning. You see, that's why it's called substances. The thing that people are exposed to today is unbelievable.
All right.
There are some that naturally occurring. If you live in the north, they will tell you something about zakami.
Meaning?
It's a seed. It's a naturally occurring seed.
Okay.
But somehow people find out that it could be used. It still surprises people like me.
Right.
And also in the south, you see gegemu.
So for someone to do that, I'm just curious, Dr. Adedeji, and I know you must have had some levels of medical practice or perhaps some health-related practice, so to say. So does that prove that the person is normal? I mean, if you have to go to the sockaway to inhale for you to feel all right, doesn't that mean something is wrong somewhere?
Absolutely. I like the way you look at it. That is why we're now considering substance use, substance abuse, and addiction as a public health issue. Because, addiction is a mental condition and is a chronic relapsing mental condition. So it is not, you don't look at it in the sense of insanity, but you look at it in the sense of something unusual, but which also can be managed in the line that we manage diabetes and hypertension. So that's why we're telling people, don't look at people who use drugs as people who are criminally inclined, or people are just not just correct,
right,
or people are just, we should throw away. No, they're not. The people who need our help.
All right. Okay. So we'll talk about this help and what kind of help can be rendered, but I still need you to break it down for us. So when we say drugs and substance abuse, Dr. Adedeji, what do we really mean? Because, like you said, I might be taking this thing and perhaps I'm deriving some kind of pleasure in it. At what point does it become an abuse?
For instance, in addiction, we say there are 5 steps to addiction. Initial use. There is the initial use that will condition you to what next. If you use it and you don't like it, you are not likely to continue. And also there are some people who they like it, they say, but I don't need it because of this reason. If I want to be a doctor, a lawyer, I cannot do this because this would derail me. And then it goes on to go into abuse. Abuse is the guy takes it, he likes it, he can't stop, he wants to take it again. And then he moves on to a state of tolerance. And then I take it, he knows the conditions that are associated are not palatable, they're not really good, physically, mentally, whatever. He says, oh, I will take it. Until he gets to the point in which addiction comes, becomes a compulsive use. He can't stop himself, he has no choice. He must use it for the reasons for which he uses it. So that's the progression that it takes. And when you say drug substances, I want people to look at drugs that we're talking about different from medications.
Okay.
Medications are the one prescribed in hospital and then you use for medical reasons. But when we are talking drugs, it connotes an illegal use of even a normal drug or prescription like tramadol. When we give tramadol for moderate and severe pains. But what I tell people is the tramadol in hospital is usually about 50 milligrams. And they say take it twice a day for about 2-3 days.
All right.
Because we know the connotation. But the ones on the street start from 200 milligrams.
Wow.
So it's absolutely different. And this is made specifically for a condition of abuse. And that's why we need to be careful about the consumption of these things.
All right. You've mentioned some earlier on. Let's just look through them because it's readily available.
Oh, yes.
So how did we find ourselves in that point? I mean, how come these drugs you mentioned, those ones that are consumed out there, the louds, the colos, and all of that, how comes I was just talking to my colleagues earlier on, and I was making them realize back in the days, what we knew was just marijuana. And for anyone to even get to be in possession of marijuana, it has to be done secretly, or you either have to go to the bush to go and smoke that. That's why the name Igbo was derived. So, but now it's everywhere, and it appears it's readily available. You can get it from virtually everywhere.
Yes.
So, how did we get to that point, Dr. Adedeji?
What happened was people started, and then from experimentation, we begin to concoct some things out of the original ones. Like you mentioned, marijuana is naturally occurring, is like a natural thing.
Right.
And then the synthetic marijuanas are the ones you mentioned: Colorado, Arizona, Loud, and all. You see, those ones, you know what I tell young people? They just say, I smoke weed. Many times they don't know what they smoke, because the weed they say could be synthetic, and the synthetic weed, which is like colos, is just about 10-11% of cannabis. The rest is made up of chemicals and herbs. That is why you see all those things that you see amongst them, which is not with natural.
Not made in Nigeria?
Some of them are made here, but many of them are brought in. And then, I was discussing with General Marua. I said to him, every Sunday, every week, we catch people at the seaport. Why is it that people are still trafficking in this thing? He said to me, basically it's because of greed. And that is one of the reasons why you see the pervasiveness of drugs on our street. It comes from Nigerians who want to be rich. I keep telling us, if you don't look at our the moral fabric of our nation and the value system, it's going to get worse. I said to you, it's socially acceptable. Alcohol is socially acceptable.
Right.
And yet it's a drug. And if we are not careful, from the speed at which it's being used, it will almost become staple. Like 4 years ago, Thailand categorized marijuana as not as legal. You can use it recreationally.
Right.
But only yesterday or 2 days ago, they now returned and banned it. That it will no longer, they must have seen something.
The effects that it was having.
Absolutely. You see, we pretend, we want to be sophisticated.
Right.
But we cannot bear the consequences of that sophistication.
So I'm still curious about that. So it's supposed to be illegal, right?
Oh, yes.
And it's finding the way into Nigerian ports. So what does that say about enforcement? Or perhaps our borders, are they porous?
No, it's a multiplication of things. I tell you today that interdiction is higher than it used to be. But Nigerians there was one man who brought in some drugs, and he imported machinery, agricultural machinery. And so when the things got to the port, the dogs were circling and barking. They looked at it, they didn't find anything until the commander said, let us begin to dismantle this machinery. And when they did, they got inside and they found drugs.
Wow.
So if you see the rate at which Nigerians or everybody, they're getting ingenious in the package of this. They can put pineapple. You say this is pineapple. Inside they've hollowed it and put drugs.
Wow.
So it takes a lot of also extensive intelligence to begin to get these things. For as long as they can come in, they will be available.
Lagos Traffic Radio 96.1 FM. This morning, we're trying our own little way to stem the tide of drugs and substance abuse. And this is just trying to reflect on the International Day of Drugs and Substance Abuse. Dr. Dokun Adedeji is here with us. Of course, he's the CEO of Compassionate Care Recovery Initiative, CCRI. All right, then let's get back to the roads. Still looking pretty good at this time. Of course, Route 1 is good. That's the Third Milan Bridge corridor. Route 2, Ikorodu Road, approaching Eko Bridge and slow and steady. That's the name of the game in that corridor as well. Route 3, Lagos Abeokuta, is also receiving with their good vehicular flow. Lekki Peninsula, it's smooth all the way from Peninsula, the first gate connecting the Link Bridge and the runabout there, not bad at all. All right then, so much more helping. Quickly, the flash update within the Lagos-Badagry corridor. Busy traffic at Yanosashi. This is inwards mile 2. You have influx there. You also have some bad portions of the road responsible, but you have traffic managers doing the needful within that corridor. If the updates we've given is not your experience, you can always connect with us, and that's on 08099120777. and 09153877127. Also, if you want to add your voice to the conversation this morning, why do you think we're having increased cases of drugs and substance abuse in Nigeria. You can share your thoughts with us this morning. Let's see how we take that to the next level. Dr. Adedeji, what are the causes of these teeming youths engaging in drugs and substance abuse?
What I have found out in the course of working here is that there's no particular single reason. For each person you see, it has its own particular reason. So it's a plethora of reasons. But the ones that are probably more significant that I think we should consider is family dysfunction. The way our families are today gives more room to be worried. The economic situation, the sense of worthlessness, and many times people ascribe it to joblessness and all the rest. It is not exactly that. It's just because we have not managed manpower properly and direct the effect of people.
Okay, so I was speaking with some young girls in the studio before you came, and I asked them the question, what do you think is responsible? And the first thing that came up is depression. So can youths be depressed?
Oh, anyone can be depressed. But you see, I'm worried about the way we quickly jump to the idea of depression. What do we mean by depression? When people are sad, or when people have no opportunity of seeing what tomorrow looks like, they say, oh, I'm depressed. But you see, what I see amongst our young people is a lack of mental activity. And so what usually happens that easy accessibility. Today, everything is mental health. Everything is mental health. These were issues that people were facing before. They were living. But are there enough reasons to prepare you to do drugs when they can even make it worse?
Right.
And so we need to be very careful with that young people.
Word. All right, then they also mentioned the issue of peer pressure too.
Absolutely, I agree with that. I see that a lot. But again, the thing that I've found, the locus of all these things is parental. Many times our young people do not have enough parental guidance to help them. There's no emotional support, there's no psychological support at home. And so when they now, let me give you an example. You send a 14-year-old to the university. This person is not specially gifted, I would say it's a gifted child. But because you are rushing him through school, at 8 is in primary 6. And if you look at schools in Lagos, you hardly will find primary 5 or primary 6 anymore. Many parents are in a rush to get their kids into school, maybe in competition with their friends. Oh, my child is in school and all the rest. And then so these children are deprived of normal developmental stages. So when they now get to school without guidance, and then they see people who terrorize them and say, do this, they fall prey.
All right.
Or they want to belong like their friends. So they get involved in all these things.
All right. So poverty, is that a driving force as well?
Poverty can be, but you see, it's an interesting thing. Poverty, yet they can afford the drugs. But also poverty in the sense that if you go to certain areas of Lagos, I don't want to mention them, you see young people at about 8, 9, 10 o'clock, they're just sitting around and also nothing to do. The whole environment is depressed, there is deprivation, and that also, but for me, I'm careful to take those things that are circumstantial as reasons. If we all get together to improve the status of our country, poverty will disappear. But will drugs disappear? Of course not. Then we'll find another. Elitism is also another reason people belong. Some people work in professionals use drugs.
Okay.
So it's not poverty, it's not as if, but again, people find a reason to justify the aberration.
Right. So at what point does it become addiction?
At the point that the man can no more stop himself, he can't help himself, it becomes a compulsive, and there's always a drive to use. And that's the stage in which the person must be confined to help. You see, but for me, what I've said to people, those stages I said to you are that the 5 steps leading to addiction. Each stage is the point in which you can intervene. But when it gets to addiction is when a man now leaves his home, he begins to live in the drug joint, he forgets everything that is positive in his life and he concentrates on drugs. Without drugs, he can't do anything.
So he has become a slave.
So he becomes a slave to drugs.
Wow, which is quite unfortunate. All right, Dr. Adedeji, you've been working in this terrain for how many years?
About 32 years.
Wow, so I know you are at a point in charge of CADAM, right?
Yes, I was.
And now you have
my own,
which is called the Compassionate Care Recovery Initiative. We'll talk about what you do, but can those who are addicted, can they get out of it?
Oh, absolutely. I mean, that's the encouragement that one gets. Because I've worked with a lot of people, particularly the ones in universities that have been referred to us, who were suspended because they tested positive. And some people in the office who were sent to us, and we helped them, and they went back after clearance. And many of them today are doctors, are lawyers, are accountants, in different professions. Some are senior pastors in some churches. So for me, because of what I have seen, I don't give up on them, no matter how long they've been in drugs. It depends on their own also volition of wanting to stop, which sometimes they do. Many times they do. They want to stop, but they just need the help to stop.
All right.
But there's hope. Yes, they can stop.
All right, then. Dr. Adedeji is a specialist in this area. And if you want to ask him any question this morning, feel free. 091-5387-7127. Yesterday was International Day Against Drug Abuse. And this morning, we're taking that conversation to another level, because I feel one day is not sufficient for us to talk issues that relates to drugs and substance abuse. So feel free. 080-99-120-777 and 091-5387-7127. All right, some questions are coming in. Dr. Adedeji, the CCRI, what do you guys do?
What is essentially what we're doing in Kadam, the treatment and rehabilitation of people. We now call them people suffering from substance use disorders.
Okay.
We hardly use those derogatory terms of addiction. It's an addict. You say somebody suffering from the substance use disorder. So that's what we do. We help them. We also try to do a bit of advocacy, like what I'm doing, go around, talk to people, go to churches, go to schools, and intervene in the matters of these people.
So is there a center?
Oh, yes. Our office is in Anthony. Our office is in Anthony in Adebayo Mokolu Street. And then the center that we rehabilitate them is in Abeokuta.
Wow.
Where we have some people in there now.
How many people have gone through that center?
Since we started in January, we've had now about 10 people.
Okay, this year?
Yes, this year.
Now, these are drug addicts?
I don't.
Okay, you don't want to use that name.
Yeah.
Okay,
these are people
who are
suffering
from substance disorders.
Yes. Because, like we told the universities, these people who test positive are not addicts. They're occasional users, social users, and just experimental users. So if you can stop them at that point from progressing, they do well.
So have you had those who are dependent on it?
Oh yes. When I was in Kadam, we used to go to the joints. And people used to come themselves, and then those people will be there for years, and many of them cleaned out. So that's the comment that I want to give to parents: that look, don't throw up your hands, don't give up on these people.
Right. There's a pool of people out there, teeming youths. You see them holding all sorts of substances. We'll get to that shortly. But a question here for you says, TGIF, Dr. Adedeji, why do you think young people in particular are drawn into substance abuse? Iyanu is sending that one in from Oregon. Iyanu, thank you so much.
Iyanu, thank you. You know, the thing is, it's become like fashionable. And one of the things that we should worry about is the influence of social media and the influence of our influencers, the people who are artists, who are musicians, and the songs they sing to glamorize these things. So it entices a young person who is vulnerable,
right,
and then who is impressionable. They say, "Oh, this person can take it. Why can't I?"
And so some have said the regulatory bodies have not done enough in this regard. I mean, what does it mean if you are showing a music video and a celebrity, so-called celebrity, is holding something by the hand, and when it doesn't look as if we're endorsing it?
I mean, for me, that is some of the things we should hold our authorities to. And also it's not something that many of them don't even have understanding. Many of these people who are in all this authority, they don't understand this and they don't know what this means.
Right.
So until we get them educated to let them appreciate the influence that this has on young people, they may just not know, they may just think it's fine. And then say to them, how much do we go? How far do we go that they don't call it a curtailment of freedom of speech?
All right. Okay, so that's something that you have to do, much more engagement with the different stakeholders. This one says, good morning. In a deeply religious society like Nigeria, some believe addiction is purely a spiritual problem. What's your take on that, Dr. Adedeji?
I don't agree. You see, I'm glad the person said a deeply spiritual. You know, the thing that I've seen in this country is interesting. The irony. There are a lot of churches, there are a lot of religious bodies, yet there's so much little you see as a consequence of that. But it's not spiritual. It is, there's a spiritual connotation in terms that we used to be holistic in managing this thing, but it's not as if it's spiritual, then you go to continue to pray.
All right, do you have a call? All right, then 09153877127. Feel free to connect with us and ask any questions that relates to the issue of drugs and substance abuse in Nigeria. And of course, my guest, who's very experienced in this area, is here to respond to it as well. This one says, good morning, Victor and Dr. Adedeji. Please, what are some of the signs families or friends should look out for if they suspect a loved one is using drugs?
Okay.
This is Chinasa Hart. All right. Thank you so much.
You see, thank you, Chinasa. The thing that I say to people, the first way to look at it is, when did your child change? If we're very conversant with and relating to our children very well, the moment we say any observant in the change of their behavior, antenna must be raised. But again, to be specific, when you see reddish eyes, the person becomes unruly, the grades are dropping in school, it becomes like a truant, he doesn't want to share relationship with family members anymore. He says he's an introvert, he wants to stay alone in his room. He goes out at hours that are not regular. He goes out, let's say, 4 and comes in the evening and comes back about 11 in the night. And then his dressing begins to change. I mean, those aberrant things are the things parents should look out for. But let me quickly sound an alarm. It does not mean that when you see one, the person is using drugs.
Okay.
It's better for parents to engage their children in discussions, know what they do, know their friends, know their inclinations, and that helps you to quickly decipher if there's anything wrong or not.
All right. So I was saying there's an army of youths out there who are consuming this, and you see them all across the roads. Is there anything that can be done to get them off? Can we succeed in that?
Yes, we can. But as this year's theme says, the evidence is clear. Prevention is so critical. Invest in prevention. You know, when you begin to talk about taking them off the street, rehabilitation, and then you've lost a lot of time. And then what we should look at is, how do we stop people from getting involved? And that is one of the things we are doing this morning. We are sharing experiences. We're going to different areas. I mean, somebody says spiritual. If the churches and the mosques can begin to address this issue as altar matter and talk about it and be open about it and be not judgmental, even families not being judgmental, we'll get a better result. When we let them know the dangers and the consequences and the implications of using drugs, you find that people can then make informed choices. Right. If the person now goes into drug, he has made that choice. But let him be aware. So
is this a message we can take to the religious homes?
Oh, yes. I go to churches almost every Sunday. I'm going somewhere tomorrow. On Sunday, I'm going to be in a church. Last Sunday, I was in a church, like 2 Sundays ago. We do the best we can. And we've said to schools, one of my colleagues was in a school in Lekki yesterday. So we will do the best we can. But there are still a lot more people. I mean, like, some people are listening. They will take it to their workplace. They'll take it to their schools. They take it to everywhere. And I've said, organized labor must do something. If we don't, you see, many of the people who graduate from school, who were not caught in school, we work in your offices.
That's very true.
And then they begin to use drugs, and then they create a space for use.
All right, 09153877127. Another message here says, good morning, Dr. Adedeji. What can you... Okay, it says, what do you think parents can do at community levels? It says, how do you cope with interventions from some powerful individuals in our society who use and protect these addicts? Oluwaloko is one of our regulars. Thank you so much. So,
for me, when you point a finger, 4 points come back to you. I think one of the crucial area of starting is the family level. The family is the smallest unit of society. If everything is wrong with society, there's something wrong with the foundation. So when parents begin to be parents again, not parents by financial provision, but parents by psychological support, by emotional support for these young people, they will get better results. And that's why I say, when the preaching in our institutions, rather in mosque or church, begin to change away from prosperity, away from life possession and all this, and begin to talk about value system.
Right.
Why a man needs to have a future. All these things will change. So The family unit is where to start.
All right, then much more contributions coming in. This one says, how can a parent approach a child he thinks might be using drugs without pushing them away?
Oh, very good question. But what I say to that, there must be an antecedent of a relationship with that child.
Okay.
You can, if you are not relating to your child very well, they don't see you, you suddenly come, I think you are using drugs. Of course, that's antagonism.
Right.
And it won't get results. But the thing is, when we are close to our children, when we have time to discuss with them and discuss openly, even before taking decisions about them or for them, we let them be involved. They will be. I mean, one of the things that some of us are preaching is the self-report. So somebody can come and say, Daddy, there is a problem. I have an issue. I need help. How many children can go to their parents and say that? How many parents will even believe it? Or how many fathers? I mean, I say to fathers, how many fathers go to PTA of their children's school? They don't. Men don't get involved, and yet when things get, they say it's the woman.
That's very true. This one says, amazing morning. How early is it too early to start educating children about drugs abuse? Boom. He's sending this one in from Agudo.
That's a difficult one, but the thing is this. It is the relationship you have with your child and the level of discussion you generally have that will dictate what you can discover. I can't prescribe the time, because today we know that people as young as 8 are using drugs.
Wow.
So
as young as 8?
Oh yes, I've seen them.
What kind of drugs?
Oh, the ones they start with are these sachet drinks.
Exactly.
Yes, and that's one thing that breaks my heart. When NAFDAC said, let us ban sachet drinks, it's different from banning the drinks, which our National Assembly did not understand. Banning the sachet drink, it allows availability, and it's cheap, 50 kobo. Or is it 50 naira? 50 naira, they can buy it. And there's nothing. Go and check. I wish I could show you from my car.
Right.
Many of them, go and read the label. Even the one they call bitters, they have alcohol. Some as high as 42%.
Wow.
So when a child begins to use sachet drinks, it will graduate. So we need to sit down as a country, as much as we do not want to be rather restrictive about people's chance of doing things, we also must curtail the ability of not destroying the lives of other people. I think we need to sit up and do something. All
right, then. So we can see you speaking so passionately and, of course, doing a whole lot just to ensure that we get people from this particular abuse. How did you find yourself there, Dr. Adedeji?
You know, it's very interesting. I say to people, it must have just been divine, because I went to Ife. I never drank or smoked in my life till this moment.
You mean it?
I'm telling you.
From the University of Ife back in the days?
Oh, yes. And I was a rascal. Though I was reading medicine, people didn't know I was reading medicine because I was everywhere. But when I finished, a lot of my friends died in accident.
Wow.
So when I finished and I wasn't going to church anymore, so I said to myself, why did God save me? It was not until I got into this thing in 1992 did I know that this is what God wants me to do.
Wow.
So for me, I think it's divine.
It is, and I can tell you, you've been doing a whole lot in that regard. For those who would like to connect with CCRI, which is a Compassionate Care Recovery Initiative, how can they do that?
Our office is 9C, Adebayo Mokolo Street in Anthony Village. My own number is 0803 302 3620. 0803 302 3620.
All right.
Our office is in Anthony.
All right. So my final question: drugs and substance abuse, does it respect age?
It respects nothing. You know, the survey that was done in 2017, they looked at 15 to 64. I have seen a family come and said they wanted to bring their father, 65, who is on alcohol. So it doesn't respect age. It doesn't respect your religion. It doesn't respect your education. Check everybody who take it. You see that all kinds of people take it, and at any age. So it's no respect of anything.
All right. We'll leave it at that for now. It's nice having you. What's your thinking in the next 10, 15 years? Do you think we can get out of this?
I think we can. That's my positive aspiration. That if we do what you are doing today and a lot of people get more interested and we raise the level of awareness, I think we can win this war.
Right.
I believe so.
It's nice having you in the building. Thank you so much for being here.
Thank you, Victor.
All right. So he is Dr. Dokun Adedeji, and of course, he's the CEO of Compassionate Care Recovery Initiative, CCRI. Like he told you, you can always connect with them from time to time. If you have anyone, or perhaps you know anyone who's suffering from any of these disorders. Flash update coming in says there's a falling 40-foot container laden truck at Oduero. This is inwards Iyanoiba along the Lagos-Badagry Expressway. So take note of that. Traffic has been diverted to the main carriageway at ECC Yard. Efforts on for the recovery of that vehicle. We have to go. Mike James has produced the program as usual. Maximum shout out going out to Kwayemi Shodunke and Remy Aloko. Our social media unit, our executive producer is Tayo Akonle. My name is Victor Oteri. I'll be back shortly for The Benchmark.